seems to be in the news more and more in recent years. Talk about what global health is and why it's important to pay attention to it.
Thank you for welcoming me in this studio. I'm Sandrine Nikuze. So, normally, global health is the health of people in global context. But by defining it, this is an area of study, research, and practice different ways to improve health and achieve equity in health for all people. So, all these actions are done mostly on health problems which transcend more national boundary and can be solved by joining together. So it is important to pay attention to it because all found health problems which can transcend national boundaries can reach out to the global context, and to prevent them when they are in global context is hard unless people join together and do something. Second, people get to be updated of what is going on in different areas differ from where they are standing or where they are living.
Disease can come to us in different ways.
Yeah.
Explain the difference between communicable and non-communicable disease.
So according to Alimanda County Public Health Department, a communicable disease is the one that is spread from one person to another person through a variety of ways that include contact with blood and bodily fluids, breathing in an airborne virus, or by even being bitten by an insect. While non-communicable diseases are diseases which cannot be transferred from one person to another person. They are also known as chronic diseases. Therefore, for type of non-communicable disease according to World Health Organization, the first is cardiovascular diseases like heart attack, stroke, cancers, different types of cancers. There is also chronic respiratory diseases, and also there is diabetes.
Let's talk about Ebola, since I'm sure most of our viewers have heard a lot about that. What is it? Is it communicable or non-communicable? How do people get it?
Ebola, known as hemorrhagic fever, is one of communicable diseases because Ebola is transferred from one person to another person. It is a rare and deadly disease caused by infection with one of the Ebola virus species. So, by now, currently, there are 5 identified Ebola virus species, 4 of which are known to cause diseases in humans. Ebola virus, so the 4 ones are Zaire Ebola virus, there is Sudan Ebola virus, there is Thai Forest Ebola virus, there is also Bundibugyo Ebola virus. Then the 5th one is Riston Ebola virus, which causes disease in non-human primates. Then, according to Center Disease Control and Prevention, the first man to get Ebola was through human contact with an infected animal. So when a human is infected, he or she can infect others through direct contact, through broken skin, or mucous membrane in with blood or body fluids such as urine, saliva, sweat, feces, vomit, breast milk, and even semen of a person who is sick with or has died from Ebola. Then objects like needles and syringes that has been contaminated with a body fluids from a person who is sick with Ebola, or the body of person who has died from it. Then there is infected fruits, bats, and primates, and also possibly from contact with semen from a man who has recovered from Ebola, for example, by having oral, vaginal, or anal sex. Yeah, so it is really very dangerous because if someone has already recovered from it and then he can still transfer Ebola, it is a serious disease.
What would raise a person's risk of getting Ebola?
So something which could raise the risk of someone to get Ebola, there is caring people or families who has already infected. This increases the risk of getting Ebola, especially healthcare providers who were working, or who are still working closely with infected families and persons. Then also having sex with a recovered man can raise the risk of getting Ebola. This is because from the research made, they have found that Ebola is still in semen of a recovered male, and they don't know yet how long it might take to live completely because it depends on a person.
So, to prevent or at least lessen the chance of getting Ebola, what should people do?
So in order to at least reduce the chance of getting Ebola, people need to practice careful hygiene. For example, you need to wash your hands with soap and water or an alcohol-based hand sanitizer, and avoid contact with blood or body fluids such as the one I talked about, breast milk, sweat, urine. And also you need to avoid handling items that may have come in contact with an infected person's blood or body fluids. You also need to avoid funeral or burial rituals that require handling the body of someone who has died from Ebola. You also need to avoid contact with bats and non-human primates or blood, fruits, and raw meats prepared from these animals. So you also need to avoid contact with semen from a man who has recovered Ebola until you know well that the Ebola has already gone from his semen. So if you are a healthcare provider, you need to wear appropriate personal protective equipments if you are going to meet with uh, infected people. You also need to practice proper infection control and sterilization measures for, and also, like, you also need to avoid contact with infected persons. You also need, in case it happens, you also need to, like, to tell the officials that you have, if it happens that you get into contact with someone who has Ebola, you need to communicate it ahead of time so that they can know what to do.
Outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation, and even panic about what the disease is, how it is transmitted, and how likely people are to get it. Talk about the need for educating people about facts versus myths.
It is true that there are different myths about Ebola, but facts should be clear, and they are clear. So, for example, there are myths that Ebola is transmitted via water. This is not true because Ebola is not a waterborne disease. So also Ebola, it is not transferred via hand touching unless you touch your eyes, your nose, even your mouth. So it is really necessary that people get to know more the myth about Ebola, and also they need to know the facts about it. So we are planning to give a detailed workshop on Ebola in different areas, and I hope this is going to help people know more about it. And also I will take this advantage to tell people to stop spreading the myths around. If you have any question, you can approach your healthcare doctor or your healthcare provider, and then you ask more information about it instead of taking the myth or spreading them around.
How about the complications that Ebola raises for the rights of travelers and the responsibilities of governments? Casey Hickox, for example, a nurse from Maine who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restrictions thrust upon her, restrictions that she was very much against. Briefly describe the difficulty of balancing individual rights and governmental responsibility.
Yeah, I hear the case, and it is really bad to take. Like, if she had many things to work on and then they took too much time, it was really bad. But on the other side, people need to understand this. It is the government responsibility to save citizens, and also people's responsibility to protect themselves. If if there are some people who don't really want to protect themselves, then the government is going to do it for you. As government, there are norms that they set norms that if someone went or come from those contaminated countries, there is a process to pass through so that they can make sure that they are safe. So they cannot let you go without confirming that you are free from it. So people need to understand this, and they need to be patient about it, because we don't the government does not have any other way instead of checking if you are free from it and then they let you go. So you need to be aware of it, that they're going to take your time, and then prepare your things ahead of time so that the government can be safe, the citizen can be safe, and then the whole country can be safe.
Let's talk about smoking and tobacco use, which is considered a big World Health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it do to the body?
Smoking is not good at all. It's not good at all, because it harms health in different ways. First, when you smoke, the toxin from the cigarette enters your blood. Once they are there, they make your blood thicker, and they increase the chance of making clots. They increase blood pressure and heart rate. So they narrow arteries, and this decreases the oxygen-rich blood circulating to your organs. The formation of clots, narrowing of the arteries, can lead to heart attack and stroke. Then smoking increases the risk of getting stomach cancer and kidney cancer. It is hard to find, it has found that if you smoke 10 cigarettes a day, you are 1.5 like to get kidney cancer than a non-smoker. Then smoking reduces the oxygen that gets to your skin, and this means that your skin is going to age faster than expected, and it is going to change the color. It is going to turn to the gray. Then smoking can cause male impotence, and it can, as it damages the blood vessels that supply blood to penis, then it is going to cause impotence. Then for women, it can lead to infertility. If you are pregnant and you smoke, so you are increasing the chance of losing your baby. So smoking is not good. If you are smoking, I would advise you to stop, like try to stop it, because I know it can be stopped. You can stop smoking.
What about secondhand smoke? Explain what that is and how it affects people.
Yeah, secondhand smoke, also known as environmental tobacco smoke. This is a mixture of two forms of smoke that comes from burning tobacco. The first one is the mainstream smoke, which is the smoke exhaled by a smoker. And then there is side stream smoke, which is the smoke from the lighted end of cigarette or tobacco. This type of smoke is dangerous to life compared to the mainstream smoke. It is a higher concentration of cancer-causing agent. It is more toxic than mainstream smoke. It has small particles which enters the lungs and body cells easily. Then second-hand smoke have the same effect to non-smokers, the same like a smoker does. So if you live with someone who smokes and you don't smoke, then you are going to have to share the same effect as if you smoke too. It causes cancer, it causes heart attack, all the diseases that are caused by smoking, then you're going to get it even if you don't smoke.
People don't typically think of tobacco as a drug like heroin or cocaine, but the addiction it creates is strong, isn't it?
Yeah.
Shouldn't we think of tobacco use as a form of substance abuse?
So, yes, I can consider it as a substance abuse because it has many impact on, like negative impact on human life than what people think. In addition, by defining what is substance abuse, so like the substance abuse harm, or like the substance abuse result in physical, psychological, emotional harm to the users and others. So if you compare it to tobacco, then you will find that tobacco meets the criteria of substance abuse, which is the reason why I consider it as a substance abuse, because it affects the users and also it affects non-users.
Thank you for talking to us.
You are welcome. Thank you too.